Aged care is our next slide. This is something that I do want to talk a little bit more about, Tone. For those of you who are unaware, aged care in this budget has been addressed because it was a failing service. We're well aware of what happened in the Royal Commission. Everyone knows that money, infrastructure and people have needed to be thrown at this. So it's nice to see they've started to address that. There maybe need more done on that. For today's discussion, this does have an impact on those who may need to take advantage of aged care in the future or have elderly parents. It can be a minefield. It really is quite a daunting task, both emotionally but financially. So to address it, what we've talked about here, 80,000 additional home care packages over the next 2 years, introducing new star rating to allow aged care recipients and their families to compare providers. So again, still talking about safety. A new funding model, that's something that will need more reflection, and I would be certainly reaching out to your advice professionals to discuss that further. Increasing the government's basic daily fee supplement. Again, that does have an impact when you're starting to look for providers. From early 22, increased funding to improve access to respite care and support through the government's care gateway, which is great. Aged care workforce will receive funding, which will include upskilling for existing workforce and providing training for thousands of new aged care workers, and establishing a new governance and advisory structure. These proposed reforms of the aged care system in response to the Royal Commission. So, as I said in our opening or introduction to this slide, a lot of this is to focus on really improving a system or an area of our health services that needed it, but it does have knock-on effect to our financial situations. Tony, have you got any insights that people should be thinking about?
Yeah,
if they're facing this.
Look, it's a very complex area. So,
it really is, yeah.
And from an advice perspective, it's something that I would strongly suggest that if you're heading down that path, or your parents are heading down that path, to certainly seek advice. The government has thrown, I'll say, billions as part of this budget in relation to aged care. They're providing incentives for nurses to stay longer. So the longer you've been there, there's incentives there as well. They're providing more dollars for, as you mentioned, in terms of respite and home care. They realised that there was failings around, as you mentioned, failings around this as part of the Royal Commission, and that this is something that they need to spend a lot of money on and a lot of care on. And I think this will be the start of what we see over the next number of years.
Yeah, great, because it can cost homes if it's done well.
Absolutely. It's a very complex area, and it can be very costly if not done in the right way.
Correct.